Hello to all the Nursing 342 Community Wellness students. We are now in week 2 of our course. What we're going to talk about this week is different ways that you can approach the work that needs to be done when you are a community health nurse. So we're going to look at some frameworks, some tools for you to use that will make this very, very important and quite often very complicated job a little more easy. So first of all, maybe the best thing to do is to really consider again what is community. And it's not what non-healthcare professionals, especially non-nurses, would think of. When we think of a community, it's a town or a village or a portion of a larger city. And in some senses that could be correct, but we have to dig a little deeper, because if we're going to help improve the health outcomes in what we are looking at as the community, it needs to be at a more personal level. And so it's not just that they're a resident of a town or what people think of as a community. It's what do these people have in common? Where are their relationships built? They have something in common, perhaps that they use the same agency or institution. In your textbook on page 219 in table 12.1, that does a very good job of defining for us what we can consider as community. When we're looking at it as place or people or their function, it gives you a very good idea. What is most important, I like, about this chart is that it gives you some examples of where you can find data if this is the way that you are going to be looking at community. So when I was talking about community and drilling down deeper and making sure that we are focusing on individuals or a family within a larger unit, this is exactly what I was talking about. Just because the location of your community health practice is in a community, we want to really make sure that we are looking at the individuals within that community, because that's the only way that we're going to build true strong partnerships or collaborations. And we know that once we bring patients into the planning and the identifying of issues, we know that our likelihood of a positive outcome is going to be stronger. Thinking about the health belief model and knowing that really what remains for us as an overall goal is that the community becomes stronger individual by individual by individual, and we start developing in people that they can role model for others. So we'll move on and apply this to some specific ideas later on. So when we're thinking about developing goals and then identifying the means by which we can achieve those goals to improve the health of a community, we may need to first help those community members see that they are presently living in a situation that is not optimal health. And then, as you see, I put the health belief model on this slide, and if you don't remember what that is, go back and review that, because that is a key approach, a framework for you to begin building those relationships with your community members so that you can help them identify that change is necessary, how it will benefit them, help them to see that they actually can be part of this, that they can move through the process without too much pain and difficulty, and that the change is going to ultimately be a very good outcome for them. So there are 3 common characteristics of community health, and so we start looking at the status. Then we move to what is the structure and what is the process. So when we think about status, it really and truly is what are the physical components that have been measured in the community, and who has been looking at this. And they mention here morbidity and mortality rates. That is definitely something that we want to look at. It's a good place to start as to look and see what is the current status of health for this community. We also want to look at what is the emotional status of everyone here. Are there some that are being more strongly affected by whatever is the issue that we're developing with them, or helping them to identify as being a negative or an area for change? And we can have people all along the spectrum, people who are just very, very emotionally involved in this and very dissatisfied, to those who are completely unaware of it. And so we have to help everyone within that community see the benefits. What under status is social, and we want to look at the crime rates. That's definitely a component of it. We want to look at absenteeism. If there's a large factory in the community, that may be the source for the negative health outcomes that are being seen based on mortality and morbidity. Definitely we want to look at the infant mortality rates, and that there's going to be an emotional component to that. But it may only be, affecting one or two families, but the likelihood of it spreading or occurring in other families is huge, and it's part of our job is to help everyone see that. So the next thing we look at is the structure. So what is already present there? What are the services and the resources that are already there in the community? And quite often this is you being a third party, so to speak, entering in and looking at the situation in the community through a different lens than people who are living and are immersed in it. And it can be a breath of fresh air. And that is where the windshield survey comes in, which you will each be conducting on a community other than your own, because you can't be objective quite often, can't see the forest for the trees. So that is something that we need to help people work through. And then what is the process that we can engage in to create an effective community change, starting with the awareness of an issue and helping them with the problem solving and trying to be positive and helping them see the possibilities and where they can reach out for help through this. So one of the things to think about is, what are your resources when you are approaching this very important and quite often complex task with a community? And that is for you to realize that the Healthy People 2020 document and essentially website is an incredible resource for you. And quite often our members of communities that we're working with, again in partnership, we're working collectively with them to bring about this change, is that they do have access to the internet in some form. But the other thing to think about is that you have access to the internet, and there are wonderful resources on there for you to use in approaching many, just a huge number of different issues. There are printable things there for you. There are even video clips that you could download to a laptop and bring into a meeting with your clients in the community. So what we are also need to be mindful of is that we're not the only healthcare professionals that are going to be involved or should be involved. This is not something that we work in isolation on accomplishing, and we should not. We need to embrace the interprofessional work. They are specialists in different areas that we just have an awareness of, but if we brought them in and they were also our partners in this, we're going to be, much more effective in helping this community resolve whatever the issue is, and much more likely to bring about effective change and end up with some positive health outcomes. So you might be a bit concerned or feeling a little bit overwhelmed here, but I want you to go back to something that you know well, and that is the nursing process, where we do the assessment, we do the data collection, we do the planning, the implementation, and then of course the. So we already have a lot of this data available to us, and with the internet we can find that data very easily. You can do it from home, but the other sources that we need to think about are actual interviews. And who is it that we can talk to in the community, who's in a leadership role already there in your public health, in your houses of worship, in businesses, in the people with them sitting down in their home and doing this. And so you bring this all together in a logical format, a composite, so that you can take a look at that. Now, what is that data going to look like? It can be everything from facts and figures about morbidity and mortality rates. It can be the census, what is the actual population. It can be, what are the maps, and looking at even a Google Earth picture. It can be transcripts that you write up after recording an interview with someone. So these are all different assessment pieces that you would begin with as you're working your way through the nursing process. Evaluation at the end. So there's nothing wrong. In fact, it's absolutely wonderful to be using our nursing process. After all, we are nurses. And I think there's a lot of the other healthcare professionals that understand that we do have that process, and they're comfortable with that, and we can bring them in. It's up to us to identify how they can best help us, and the only way is going to be through communication. So first of all, we're going to start with the assessing. So when we think about assessing a community, whatever that looks like, is that we have to collect some data, and then it's up to us to interpret that data and start thinking about what other data we need, and it starts going down a pathway, and you can think of it as like a critical pathway where one thing you find leads you to another, and you have a decision to make, and you keep branching off. And so the wonderful thing is that with the census that happens every 10 years, we're doing a much better job with our health informatics now and collecting data from patients. We know that there's a lot of it is already out there. So now that you've got your data gathered and you have begun to organize it and look through it, the identification of the problems usually rises very quickly to the top. It becomes quickly evident where the issues are and what needs to be done. So again, though, we need to make sure that we are talking with the members of the community, because what we see as being a huge issue that is just like a sore thumb, or as evident as the nose on your face, or some of the sayings, is not even an issue for people. They don't see it as worth working on or making significant changes in their lives to resolve, but perhaps that has to be an education time for us. It's time for us to help them see in a caring way, in a respectful way, help them see the long-term effects of this, and we bring in the evidence, which we're going to be talking about later. So now we need to plan. What is it that needs to be done about this? Now, again, this has to be done in collaboration with the members of that community. We have to sit down, bring people together, go through what data we have come up with, share with them what we've identified as being an issue, and see what needs to be done, what can be done, and that is going to be talking with, remember we talked about looking at what is the present structure available, thinking bigger than that, maybe not what's available locally, but what's available on a county level that we could bring in as resources. And based on all of that, we've already done that community assessment. We've already found what's available out there, we as the nurses. Now we share that with the people of the community, and together we establish goals and set objectives and think about what are the interventions that need to be done, and break that down for them and help them move through that process. How much we are involved, that varies depending upon what the topic is. Quite often we are the nurses who identify it initially, and then we mobilize the troops, so to speak, and bring the other people on the healthcare team in to help resolve this problem. So when we get to the implementing stage, like I said, we need to bring in our professional partners. And we need to decide what exactly is the best role for us being the nurse. Quite often that's that we are the content expert, or that we are there to help measure the outcomes from a physiological aspect, weighing babies, looking at collecting more evidence from the healthcare system. Those are some of the things that really would help the team as a whole and is within our realm of expertise. So it's really going to, depend on the nature of the health problem, what are the other resources within the community, and where can we be involved. It may not even be our own decision, but we know that we're going to become involved as much as we can, and we're going to definitely share in the work of changing whatever has to be in there. So then quite often our role in evaluating how the interventions that were developed with everyone and measuring the outcomes is very important, and that's where we can play a significant role as well. So in your text on page 230 is figure 12.1, and that's just a nice summary of the moving through the nursing process to help a community resolve a health outcome. And at the end of that, I want you to look and see that during that evaluation process, it may be that, and it points throughout, is that you may be helping, your role may be renegotiating the goals and the objectives with the community members. And I say that that's your role because quite often the nurse has the strongest, most personal relationship with the members of that community. Remember, we're a trusted profession. We engage in conversations with people on a level that even social workers don't get to have because the nurses are seen as more trustworthy quite often, that we don't have ulterior motives of pushing them out of social programs or coming in and wanting to take away their kids because there's health issues in there. So be aware of your role there. Keep a close tab on how you are seeing your patients, your clients. They're working their way through this whole process, and be aware of where you need to step in and be their advocate or help with further education if they're not understanding what is trying to be done by other members of the interdisciplinary team. Now, another tool for you to work through pieces of so that you can get a handle of what is going on and perhaps finding the origin of the problem is the epidemiological triad. And so I know this one says plant diseases, but it doesn't matter. It can be applied to humans. So I want you to look at the pieces of this. And on the outer corners we have the susceptible host, and that's our client. and we need a pathogen, something to be introduced into the situation that could cause us harm or could be the reason for our patients being in a state of not optimal health. And so what is it about the environment that's actually favorable for the pathogen to be able to take hold and cause illness? So if you look through, it really does take all three of these to be working together and be optimally present at a high enough level or a low enough level. If we look at the health of the host, if they're not in the healthiest state that they can be, they're vulnerable, and that creates a favorable environment for the pathogen to move in, and we end up having disease. So I thought that this was a great illustration that would help people understand the relationship between these different factors. When we're out there looking for that, in that analysis or assessment part, and then we move into the, analysis, what do we make of all of these statistics, this data that we've collected? I really want you to be thinking evidence-based and looking at that data, wherever it is that you're getting it from, through the lens or the eyes of a researcher. Because we know that as a profession, this is the basis for what we do. It's the scientific basis for our nursing practice. So we really do need to look a little further. It's our responsibility to go out and find external resources that either support what we have found or they negate what we have found. And we need to bring that to the table and share those findings in an educational way, not a dictatorial way, with the other members of the interprofessional team and also with our members of the community or our clients. And we know that when we bring in good sound evidence, and we're going to work through what is good sound evidence, that we're going to definitely have better outcomes. We're going to be more efficient in what we are doing, trying to resolve this health crisis or negative influence on people's lives. We're going to be much more efficient. We're not going to go down the wrong road or start trying to implement things that really have no basis in proof. So we really want to go out there and do a diligent job of finding evidence and help us build the whole plan before we start making those key decisions in how we're going to actually implement this change that needs to happen. On this slide, I put this in here just for you to have a reminder of some of the key definitions when we're talking about evidence-based practice. And we play a role in each of these, more strongly, obviously, in evidence-based nursing. But evidence-based medicine is really being aware of the evidence on which our practice is based, the soundness of the evidence and the strength of inferences that we can make based on that evidence. The other thing is evidence-based public health. So this is exactly what I've been talking about, is a public health endeavor. What are our goal that we've done, that we have created, the objectives, the meetings that we've had, the planning that's been going on with in a collaborative way with the members of the community and the other professionals. So we're making sure that everyone is as informed as possible, that the conversations that we are having are very explicit. We're doing it in a judicious manner, meaning that we're doing it quickly. We're not letting other things distract us on what could be a critical issue. And it's helping us to evaluate what we're doing based on research. Evidence-based nursing is how we integrate the best ideas, the best evidence that we have found into our practice. It's making us practice at a higher level of expertise. It's also helping us to identify what we value and what are some of our own personal preferences, and making sure that we're aligning those and supporting those of the families or the community members. And then ultimately, evidence-based practice includes all that best evidence from a variety of sources. Like I said, we have to do a very good job, a very thorough job of exploring out there, researching. And that we have evaluated that evidence that we have found and made sure that it is at the strongest or highest level that we can. The other thing is that we need to make sure that the community leaders are aware of this evidence so that they can use it when they are making decisions about which way things should go, what will they follow as a plan for themselves, and how does that fit into the bigger picture for the community as a whole. And here's a little bit of a reminder of where and why we have gone to using evidence-based practice as the foundation for nursing, is that, there was a growing consensus back in the late 70s among our nursing leaders. And if you remember back to your Foundations of Nursing course, they talked about how it really was in the 1960s when nursing became stronger, had a stronger voice, and we began to be more than just the handmaidens of the doctors, that it was seen as a profession, that we were gaining respect. And so part of that is that, same as medicine, is that we wanted to make sure that we were doing things not just because it seemed right, but because we could find evidence to support that what we were doing in our nursing practice was right, that there were already proven outcomes. It became then that funding was created. National Institution of Health Research started funding research in nursing type studies, and that went on until the 1990s, where we had a paradigm shift, or paradigm meaning the global way that we approach something, so that we could really be contributing to the research literature, nursing guided studies, and that these were having some very profound findings in them, and that these were studies that were done correctly. They were strong research studies, and so that began in the 1990s and has only grown much stronger. And it is our responsibility as nurses practicing today in the 21st century that we use that evidence, we build on that evidence, we replicate those studies to make them even stronger, and that we let everyone know that that's how we approach our work, that it is based on the research, and that we don't just follow whims or intuition. That's a good place to start, but then that just leads you to going out and finding research to support your own ideas. What we have here are just a breakdown of the different types of evidence that you are likely to find, or the ways that it has been gathered. And so there's the systematic review, the meta-analysis, and then of course the strongest one is the randomized controlled trial. And that's the highest level of evidence. And then, of course, non-randomized clinical trials is a little bit less. Think back to your nursing research course, and this is just a little bit of a reminder for you. What I really challenge you to do is, as you are out there looking for the evidence, is that you really do a meta-analysis, and that's where you take the results from several studies and look for those and compile that data and really build a strong base of evidence for whatever issue you are approaching. So here is something when you are looking at those different research studies. This is just a quick reminder for you that these are some of the key things that you need to look at when you are reviewing research articles. So, how was the sample selected? Was it a randomization process that they used to select those members that were in the sample? Was it a blind study? Was the sample size large enough to say that we have some strong outcomes on this, that we could generalize to a larger population? Was there a very good explicit description of whatever the intervention was that was done with this group? Do they outline their outcomes of the study clearly? Do they make sense? Would you have made the same interpretation of the evidence after reading the results? Would you have come up with the same conclusions for this study? Was there any follow-up done in this study? Did they, how long was the study done? Was this something that was just a snapshot in time, and these people are declaring outcomes of the study based on, a 2-week observation? That's not going to be very strong evidence. I mean, we want to see something change over time. What was the attrition rate from the sample size? I mean, did we start out with 200 people, and by the time we got done with the study, we had 30, and the researchers decided their outcomes of the study based on those 30? Well, that's not good sound research. What were some of the confounding variables that were considered for this study? And did it occur to you as you were reviewing this research that there were confounding variables or extraneous variables that weren't considered and weren't controlled for and should have been, and you think that they negatively influenced the results of this study? What was the statistical analysis done on the study? Was it appropriate? Did they use the right test? You're going to have to go back to your research textbooks and take a look at it. If they use the wrong statistical analysis method, if they measured it incorrectly, and then it makes the outcomes or the findings from the study essentially meaningless. On our next slide, I'm going to show you what is called an appraisal of evidence table. And that's where something you can create yourself in a Microsoft Word document and start looking at plunking in the values from the studies and seeing, what is the strengths and weaknesses of this study, and should I just throw it out? Or is it strong enough that I feel I can include it in my decision making and share it with the community members or the interprofessional team, and feel good that I've chosen something that was strong and really should be considered as part of our decision making. So here's a typical appraisal of evidence table, and the evidence or the research article is assigned a grade basically, and like I said, it's the quality of the evidence. If we can find a number of well-designed studies addressing this issue, we want to have several. Can't make a decision based on just one research finding. And then were there similar findings found covering the same topic on different research studies? That's very crucial. So you can make yourself your own table here, and then there are in nursing research books or in research books that can tell you how to grade or evaluate the different articles based on the sample size. Was it randomized, controlled? How long was the study? All those things that we talked about on the last table, those all get positives or negatives, and there are tables that help you evaluate parameters in deciding what was enough people in the sample and what was a low enough attrition rate that this still would be considered good solid research. So what are some times when going through the research process and collecting evidence is something that you really need to be doing even in your practice on an everyday basis? And so that's when we need to make a change in our own practice, when there's a protocol that needs to be developed. We want to evaluate change for our patients, for the healthcare system, for a community as a whole. And as I said before, when we need to synthesize the current knowledge and what's out there to help us when we're implementing evidence-based interventions, when we're out in practice, to actually promote positive patient and family and community outcomes. So just a little reminder that this is something you can do on an individual basis, as well as when we are looking at this for essentially other people making a change to promote positive health outcomes. Just a quick reminder on this, why is research important, and why do we need to create evidence-based practice? Here it is, verifiable by experience or experimental. It increases our own knowledge base, identifies best practices that are based on clinical practices, and improves our outcomes. We know that research does support that when we do create our interventions for our clients, whether that's an individual, a family, or the entire community, people one by one, that when we use research, we're going to have a better outcome. This is a nice reminder of evidence-based practice and guidelines that, this is a conscientious integration of best research evidence, along with our clinical expertise and the values and needs, wants, desires of our patient. These are all things before we start implementing a drastic change in how we deliver healthcare. We need to, or our nursing practice, how we need to look at all of this as a whole, and to synthesize the knowledge for the development of, perhaps it's guidelines for practice, it's standards, it's protocols, it's actually, policies, it's and at the bedside intervention, it's or a community-wide intervention. So make sure that you think about, and I put this on the next slide for you, is just a visual model to remember to include these different elements as your guideline. Don't forget that you bring clinical expertise to this too, and that we can't just impose change on people without their input. So here's the model for you. I said we have our best research evidence. That's taken into account, but then we have to filter it through our clinical expertise and the patient needs and values before we implement an evidence-based practice or an intervention. So here's the steps for the actual implementation, and that is that, we first of all, we recognize the current status of our own practice or what's going on in the community, and then, we believe that our care is based on best evidence, but we want to assure that it is, so that we have the highest level of positive, improved outcomes for our patients. So what do? We collect all the data, we talk to people, we develop, there's some kind of a clinical question, or there's something that needs to be done. And again, we appraise that evidence, we together with the community members and the interprofessional team, we make decisions on what changes need to be, how can we integrate those into what we're going to be doing, and then of course we evaluate it at the end. Of course, best laid plans are sometimes go awry, and we do our best to identify possible barriers to rolling out the plan that we've come up with, but quite often there are barriers that we just are not aware of, we couldn't absolutely have planned for, or the situation changes. So I've listed a couple of ones here for you. Please just take a moment and look those over. Try and remember them when you are developing in doing your community assessment project. You're going to have to work through the nursing process on this, and you're going to have to identify a problem that needs to be addressed. And I want you to be thinking about some of these barriers that could occur, and you need to strategize as to how they can be overcome or dealt with before they become a true strong barrier and stop your process. So right now in our world, with money constantly being an issue with the recession, that we do have to look at the cost versus the quality or change, the possible change, the positive impact of the change. And that's always going to be an issue. And we need to anticipate that. And like I said, if we do the research and we take into consideration, barriers or resources, what is the current structure, we're going to work more efficiently. We have to consider individual differences. We have to examine our own perspective quite often on what we are seeing and identify our own biases and make sure that we put those aside, we deal with them. We do more reading or research or conversations and perhaps change those biases. We have to acknowledge that everybody is an individual and they bring a whole life's worth of experience to the situation, and we need to honor that and consider that when we are developing the goals and the objectives. We want to make sure that our evidence-based practice methods for the community is oriented to our nursing practice. Remember, I said that we have members of an interprofessional team. What do we bring as strengths, being the nurses, to that, and making sure that the evidence that we bring is related to supporting our nursing practice. There's some restrictions on that. Of course, our scope of practice is one of those. Recognizing that the world is not standing still, we need to consider some of the future perspectives on community health and developing goals for people. We do have the rising cost of health care. We have the Affordable Care Act coming into play. We definitely have an emphasis on quality care. We want to make sure that we have a more fairly managed distribution of the healthcare resources. We know that those resources, meaning healthcare providers, facilities, support services, are being stretched to the max, and we need more providers. As you saw in last week's presentation, we know that there's going to be a significant shortage of family practice or general practitioners, and we have to use them as carefully as possible, and knowing that developing more nurse practitioners is likely to be a huge issue. We can't produce enough of them fast enough to meet the need, and we know that they're going to be a strong contributor to meeting the healthcare needs of our patients as we move forward. One of the things that we know is a help to us, though, is, and I've talked about this, is gathering our evidence through use of the internet. And what is even coming more strongly is that we have the in-the-moment ability to find that research with our smartphones and portable laptops, and bringing them right into the community setting and using them as teaching tools and showing our clients that what we are telling them or what we plan to do is backed up by research. So those are tools that we have available to us to strengthen the work that we're doing out in the community. One of the strongest resources that we have is the Healthy People 2020 work that is being done. This is definitely a systematic approach to health improvement. It's based on research. It's based on research more than nursing alone has been involved in this. And it really does provide a nice overview of our nation as a whole. And it can help us support the recommendations that we're making or the plans and for our clients, and helping them set goals and reasonable objectives, and showing them how perhaps what they identify as not a necessary change is truly, in the long run, something that needs to be addressed, approached, attempted for their own health long-term outcomes, and perhaps for other family members. So on the website, I gave you a link in the bottom there. It really can, if you go to that link, please, you'll have to visit it a couple of times during this course, and look around through there and find out what is actually there for you as resources that you can use while you are providing patient care, or observing what you're seeing as you're out there in your community clinical, and comparing it to what you find there on the Healthy People 2020 site, the key indicators and the objectives, goals that they have set for improving the health of our nation over the next 10 years. So what are some of the nursing interventions that really can be related to the functions of public health, the core functions of public health? And we've talked about the assessment, monitoring the health of the members of that community. We can develop nursing diagnoses for them, and we can investigate further, not just monitor the health, but actually go out there and collect some of the data, do the assessments. And we can be included definitely very strongly. We need to be part of the interprofessional team that develops policies. We can bring the data, we can bring our research to the planning and help inform the members of the public or the professional team. We can actually mobilize the community, get them going on implementing a new policy or getting their input on a policy that needs to be developed. We can also provide assurance, and like I said, we can make sure that we have strong evidence to make people feel more confident in the changes that need to be made or that are going on, and we can assure people by doing an evaluation that it was worth it. Change did happen. We're seeing improved outcomes, or we may have to renegotiate with them to see what needs to be done further, or like what modifications to the plan need to be made, and that perhaps they have to work a little stronger at something, and we can assure them that, thinking the health belief model, that they can do it. We can help them identify barriers and how to get past those. We can link them up with the resources within the community or the larger community, maybe being the county or the metropolitan area, that are available to them. But again, remember, we are seen as the caring, the trusted professionals, and we're there to provide assurance that things do happen and that they can happen. And on this slide, I don't know if you've seen this before or not, but this is the Minnesota model, the public health interventions wheel. This was developed up in Minnesota by the nursing department in the public health department. They identified 17 different interventions that nurses can do that can have a significant impact on the health of a community, or right down to the client level. And it really stays within the scope of practice for nursing, and it shows us a pathway, it shows us options that we can consider, and it really strengthens our resolve, our own feelings of self-efficacy, that this is a huge deal, public health and community health, but there is a way that nursing very, very specifically can be part of that change process. So when you are looking at that wheel, and I wish I could have put these on the same slide, but there just wasn't, so you'll have to go back when you can, and you take a look at the different interventions, and you can follow the actions that are taken. It talks about what's the intervention, the assumptions about the intervention, what are some practice examples, how the intervention relates to other interventions, basic steps, best practices, right down to what is the evidence used to develop the intervention. That's also given. So take a good look at that, and you can Google it and find it out there with a even stronger definition, but it's another framework for you to use in approaching your work as a community health nurse. And finally, I'd want to wrap up this week with some thoughts on your personal safety as you go out and approach community health. I mean, this is definitely the priority. We have to be aware of what and use your common sense, and those are your best guidelines in judging whether you're going to go into a home or if it's better to meet a client at a neutral site. Any of you who have done home health care know that you had in-services on maintaining your personal health, but also from dangers, but also for your own health. There are things that you can do to assure that you don't acquire diseases or illnesses when you are out in the community. So, I mean, this should be something definitely that you consider with every step along the way. There's 3 different resources here that can help you make those decisions. Absolutely, other nurses and social workers and people who are also out there in the community members themselves, and then of course your own observations and listening to that little voice. So that is something to be thinking about as you are now entering into the world of community health. So I hope you found this week's presentation helpful, maybe gave you a little bit of assurance that you can do this work, that you already have the tools and the knowledge, and they maybe just need to be developed a little more in the sense of how you approach perhaps a different practice setting than what has been your normal. So everyone take care, and I'll see you next week, and God bless.